Hey guys, welcome to our presentation. This is Carmina, and I'm here to talk about kidney stones that are put together by Violet, me, and Toka. Before we go any further, what's kidney stones? Well, we'll first have to talk about the urinary system in which kidneys play an important role in. The urinary system's main purpose is to regulate, filter, and process waste from the bloodstream to eventually excrete waste out of the body. The main organs involved in the system are the kidneys, ureters, urinary bladder, and urethra, which are all engaged in three processes. Glomerular filtration involves forcing water and smaller solutes through the capillary walls and pores. Tubular reabsorption transports water, amino acids, and required ions into its tubule cells, and later on into the capillary blood. Lastly, tubular secretion, which removes hydrogen, potassium, and creatine from peritubular blood into filtrates. Altogether is achieved in the kidneys and aim for the same goal of balancing the essential solutes and excreting excess waste out of the body, which maintains homeostasis. So now that we know the normal functions of the kidneys, what does kidney stones have to do with it? Right here is a case study to help us understand kidney stones a lot more. So in the summer of 2012, Casey is a 20-year-old female who was reported to the ER about severe pain around the lower abdomen and a burning sensation when she urinates. When asked about the pain's first occurrence, she says she felt a little bit of pain 2 days ago and didn't think much of it. But the severe pain started in the morning and has been constant. She says that she works as a painter, and since it's their busy season, she has been working for 4 to 5 days a week for 4 to 6 hours outside. Since she moves around frequently, she doesn't have access or forgets to drink her water, and there are times where she reaches for energy drinks instead of water because she doesn't have time to take a break in between. Note that I have put in parentheses beside energy drinks that they happen to be diuretic. That's going to be an important thing to take note of later. When palpating her skin is soft but warm to the touch. Gently pressing on her lower abdomen leads her to suddenly point out where the left kidney would be. Her vital signs were 117/97 millimeters per mercury for her blood pressure. Pulse rate was 89 beats per minute. Respiratory rate was 20 breaths per minute. And her temperature was 37.9 degrees Celsius. She was told to do a blood test and a urine test, which shows that her blood sample shows a lot of solutes in her blood. Her urine tests look dark orange and there are tiny little crystals or stones revealed under the microscope. So, what just happened? In general, kidney stones are a blockage due to excess waste. If there isn't enough water, the solutes can crystallize in the kidneys, which leads to the inability to dissolve or excrete out the waste from the body. The stone size can range from a grain of sand or to the size of a golf ball. This makes it challenging for the three processes to occur, and as an analogy, it's like having a blockage on a pipe. The water usually goes through the pipe constantly, metaphor for kidneys, and some occasional bits of dirt, which is a metaphor for the solutes. But this doesn't affect the flow though. Unless there's too much dirt, it'll turn into mud to the point where little water can cause a ton of the dirt to solidify and prevent it from natural flow. And relating back to the body, this is what causes so much pain in the lower abdomen because your body's telling you to urinate, but you can't because the excess waste is just crystallizing in the kidneys, and it will keep doing that as it is not treated. Kidneys are caused in various ways. An example is taking medicine like diuretics, and an example that I have provided is energy drinks, which happens to also be diuretics. Prevents urine formation, which again disables washing out the waste from the body. Another factor could be the client's health history or their family history, which makes a client more susceptible to obtaining a kidney-related issues like kidney stones once again. Lastly, simply not drinking enough water. Dehydration. Water is a need for us to survive. It is used in several ways. Take Casey. She was working in the summer, so chances are her body had to sweat to fight off the imbalances of body temperature, to regulate that. Another is the fact that she had little to no food she consumed throughout her shift. So chances are her body is trying to find nutrients or mainly glucose to energize the body cells. But the thing is, it needs water to do that. And lastly, because she's working a laborious job, she's easily able to get joint pain or muscle pain. And to cushion and lubricate joints, we need water also. So, because of all that, there isn't going to be enough water for the kidneys to regulate the waste. Then the excess waste in the kidneys will harden, crystallize, will turn into kidney stones. So how do we treat this? So if the kidney stones isn't too serious, it's pretty small, smaller than 10 millimeters in diameter, we can use medication that's prescribed by our doctor and drink lots of fluids in hopes to wash and dissolve all that stone out of our body. If not, there are other various ways to destroy it. Lithotripsy breaks up kidney stones, just like the other ones also, but it uses shock waves. Another thing is that it uses general anesthesia for this one, but I'm very certain the other ones also uses anesthesia because you're putting something in someone's body. So it might be a bit comfortable for the client. Speaking of the next ones, we also have cytoscopy and ureteroscopy. A urologist will insert a long tube-like tool and will break down the stone if it's small enough, but if it's large, it will use laser, and hopefully that stone will pass through the same way as the previous one. And lastly, we have percutaneous nephrolithotomy, which directly inserts a camera into the kidneys, and just like the previous one again, cytoscopy and ureteroscopy, they use a laser as well to break it apart. So what about Casey? So she's able to get treatment using cytoscopy, and this procedure helps a urologist to look inside her urethra and bladder to find the kidney stones and break them up into smaller pieces out of the urethra. After the procedure, Casey was instructed to drink 4 to 5 glasses of water to help flush out the bladder. She was also advised to limit her consumption of caffeinated drinks like energy drinks and have plentiful of water, and thus full recovery. So here are some questions about the presentation, and here are the references. Have a great day, guys!